Yeah, thank you very much for having me. My name is Amy Matthews, and I'm faculty at Grand Valley State University in the psychology department. I've been here for about 21 years. I'm a clinical psychologist by training and board certified behavior analyst. And I've had the good fortune to be involved in lots of different state level activities I'm the director of the START project, which is the state autism project funded by the Michigan Department of Ed. And I'm on the governor's autism council. So I know I am kind of on the schedule to talk about the ASD state plan. If I can go just off script for just a couple minutes. I was listening to your conversation, so I wanted to just jump in with a couple of things. One, as part of our project, we don't do a lot of diagnostics, so I will definitely defer to my colleagues who do much more diagnosis. But as you were talking, I pulled up this article from the Journal of Autism and Developmental Disorders, which is one of kind of the premier journals in autism, and they are starting to do some work in early identification through telemedicine, and this is from a number of folks at Vanderbilt. So if you were interested in looking at this, there's the article if you want to take a look at it. I'm sure there are other ones out there, but this is a pretty good group of folks, and they are comparing more of a comprehensive standard evaluation using the ADOS to some of the telemedicine assessment procedures. So I thought that just might be interesting to take a look at, and since it sounds like you guys have maybe some opportunities to do some readings, this might be a good one to look at. The other thing I know you started the meeting talking about mindfulness and self-care. It just so happens that I signed up for this free mindfulness summit that is actually going on right now. It started yesterday and it goes through Sunday. It's completely free, and you can either join during the live events, or they are recording them and making them available. And then I think you have access to them 48 hours after the summit. So even if you can't, join immediately, or if you're really busy today, obviously, you could look at them, this evening or participate tomorrow. So I just thought I would share that because it's free, available, and we could all use a little more mindfulness right now.
Hey, Amy?
Yeah.
I'm doing the exact same one. So
Are you doing it?
Yeah, I am. I started it last night. So
Cool.
Yeah, it's been great. The first day was excellent, so I can totally.
Yeah, and I love
I'll send the link out to the group so that if you want to sign up, you can still catch all the videos from day one and then all the stuff from today through Saturday. And like you said, 48 hours you have, or you can buy up and have access forever. But it's great. It's been wonderful.
Yeah. If you've got the $150, you can have them. Maybe you could even share them if you wanted to do that too. Okay, those are my just kind of couple little side notes. I do have kind of one other little kind of side note here. So I know we're kind of dealing with a lot of really different things right now. We as a project, the START project, are trying to figure out, how do we help educators and families and kids, during this time. So here are a few resources. This is not exhaustive by any means, but I thought I would put these out there just so you have them. It sounds like you're kind of creating a repository for all kinds of resources. So what we're doing on our START project site, let me move some things around here. So this is our START project website. It's pretty simple. It's gvsu.edu/autism center. And on our main page, we have this link, which is just information and resources, just to kind of respond to COVID-19. We're getting ready to put a lot more resources on here today, and we're going to be sending out, we have what's called our Start Connecting email blast. So we're going to put together a little article and kind of blast out some of these resources. So there'll be a lot more here coming up pretty soon, but some of the guidance from Michigan Department of Education about how are we responding to students. What's a little bit complicated, I have a college student, I have a high school student, they're doing a lot of things online for our kids with autism and other disabilities. It's much harder for them to do that. but they are entitled to FAPE, a free appropriate public education. So how do we allow those students to still have access to learning? So it's kind of complicated. So there's some guidance that is continuing to come out from Department of Education. There are a number of kind of organizations and state projects that have a lot of really good resources and information. We're mostly trying to link to what's out there as opposed to us, creating everything, because there's some good stuff out there. There's a number of resources. There's a really nice kind of school closure toolkit from Easter Seals, stuff on self-advocacy, just kind of all kinds of really good things. And then just ideas for activities at home, because, if you're sitting at home with kids, what do you do? So we have a committee that is going through and kind of vetting all of the resources that are being sent to us, and then we're putting them up as we review them. I do want to share one that I think is really, really good. This just came out, and this is from the Frank Porter Graham Child Development Institute at the University of North Carolina, Chapel Hill. So their autism team just put this out, and it's supporting individuals with autism through uncertain times. So if you go to our website, if you link to this Affirm right here, you can access this right here, or I can send it to you as well. But here's their table of contents. They have just all kinds of resources. They have social stories on hand washing, a calendar to help kids with just the predictability around, what's going on, even though it's pretty unpredictable, self-management, choice boards, like all the things that, we use a lot in schools, daily schedules. How do we get this to families so they can use these things? So really, really amazing resource that you could use, one for individuals with autism, but I think it's good for individuals with other disabilities as well. So I would definitely take a look at. Autism Alliance of Michigan has their Family Navigator program. They've always had that, but that's another way for folks to kind of just get some questions answered. I know they're still available and working with families. Michigan Alliance for Families is the state PTI, Parent Training and Information Grant through Department of Education. They have lots of resources for families. And then Autism Speaks has an entire page with all kinds of resources as well. So I would say, those would be some of the go-to places, not only to get information, but to get links to other information as well. So any questions about any of that before I kind of switch gears? Okay, I'm going to go back to gallery view here real quick, and I just have a quick question. So I've got 2 pages of people, so I can only see 1 page at a time, and then I got to flip over. But I'm just curious, how many of you in your current position are seeing, individuals with autism on a at least somewhat regular basis? If you could do a hand raise, that would be a visual. Okay, hold on, I'm going to go to the other page. Okay, thank you. And how many of you, maybe you're not currently working with individuals with autism, but at least have had exposure to individuals with autism in some kind of professional role? Raise your hand. Okay. And then just curious, how many of you are personally touched by autism? Family member or friend? Okay, good, thank you. All right, let me go back to share. All right, so my primary charge today is to talk about the ASD state plan. If you have questions at any point, I feel free to jump in. I don't have a problem if you unmute and just ask me questions. Completely fine with that. Just a little bit of backstory here. I worked on the original autism state plan. This was our original state plan that we started working on in 2011. And it's pretty amazing to me how much things have changed in a relatively short amount of time. When we first started working on the original state plan, there were, no state level autism groups. There was no autism insurance, no Medicaid benefit. Certainly there were people that were working with individuals with autism, but like no really kind of comprehensive system for, how we were approaching individuals with autism at a state level or any kind of state level planning. And so one of the reasons that we actually created that original state plan, one of the major reasons was you could not apply for a HRSA grant if you did not have a state plan in place. And we were looking at a HRSA grant, started having this conversation and saying, you know what, maybe we should create a state plan, not only so that we can apply for a HRSA grant, but also, it would help provide that guidance to the state and the state agencies and state organizations around autism. So it took us quite a bit of time. It took us probably a good solid year to pull together the plan because there wasn't really ready access to data and information to pull it together. And so we kind of cobbled together a grassroots, group of people to put together that plan. So one of the things we've said is this original plan really in a way kind of still stands. A lot of the recommendations are still valid today. But one of the things that we recommended in that plan is that we would do a regular review of the plan and update it. And so that's what we did in 2018 is we decided to do a state plan kind of progress review and update the recommendations. So it doesn't necessarily completely replace that original plan, it just updates that plan. One of the very first recommendations that we put into that original state plan was for an autism council. Because like I said, we did not have like a state level body that was making recommendations or really looking kind of statewide at what was happening. So it was actually one of the first things that happened. And so that was established by executive order of the government or of the governor right after the state plan came out. So this is currently an advisory body represented by 16 members. We just increased the membership from 12 to 16, broadly representative of different constituent groups, organizations, agencies, just to kind of so you have the Michigan Department of Education, Department of Health and Human Services, LARA, but then we have family members, we have an individual on the autism spectrum, healthcare providers, universities, ABA providers, state initiatives, nonprofits. It is a really broadly representative group. And kind of our primary charge is kind of twofold. So we advise and assist in the kind of development of a statewide kind of comprehensive coordinated interagency system, and we advise the Department of Health and Human Services as well as the other state agencies. And then we support the implementation of the state plan. That does not mean that we are implementing all the recommendations. We would not be able to do that, but we are working with all of the different kind of agencies and organizations in kind of helping to support the recommendations that we came up with. And then we do an annual progress review of kind of really what's happening at the state level, and we submit that to the governor's office. And so at this time, because we have this Autism Council, our updated kind of progress review and recommendations all ran through the Autism Council. So that's the group that really worked on this. And so our Autism Council like really sat down probably about 4 years ago and kind of talked about what were our priorities for individuals with autism. And the Autism Council is focused across the lifespan. So we looked at, what would be early childhood outcomes, child and youth outcomes, and adult outcomes that would be relevant for, anybody that's working with individuals. So I'm going to ask you, I hope you can all see this, and I hope that you all have your own copy of the different documents. But if you can see this okay, I'm going to just ask you all, what do you see and hear across the different ages that are pretty consistent regardless of age? Like, what are some of the things that jump out at you as kind of the primary outcomes that we're looking for?
Family support.
Yeah, yeah. Like families, like as providers, you know, we are there. You know, when kind of Sharon talks about the circle, when we think about circles of support, you know, we are out there as professionals, you know, supporting, but family is the core. You know, family's always going to be there. So family has to cut across, you know, every different age level. So families, we always say, you know, the individual with autism and the family are the core of everything we do.
In the chat, Natalie says integration.
Integration. I'm glad. Yeah, I'm glad. I mean, that's pretty much the first one. It's the first bullet, and there was a reason we made it the first bullet. You know, if you understand historically, you know, people with disabilities were significantly segregated and continue to be segregated in a number of ways even today. So, you know, our big thing is, you know, how do we create opportunities for people with autism and other disabilities to be members of their community? That is probably like the number one, you know, outcome that we want. The data supports that people are going to have a better quality of life that way. And it is, you know, we talk about it as really a civil right. So yes, integration is huge. Anything else that jumps out at you?
Again, in the chat, Haley says health, well-being, and quality of life, and Jessica says meaningful access.
Yeah. Yep. So that health piece, which I know a lot of you are involved with, is very important. You know, again, that is a right to have, you know, optimal, really physical and behavioral health. Mental health becomes an issue for some individuals, so that's really important. And then, yes, a meaningful life. One of our colleagues, Ann Turnbull, who works with individuals with autism and also had a son with autism, she said, you know, our goal is really to help people with disabilities to have an enviable life. You know, we want them to have the life that we would all want to have. And so when we think about outcomes, as we were writing, you know, this updated state plan, this is what informed, you know, everything that we did. So I kind of want you to have this as the framework going in. And the way we do this is really engaging with families, you know, using evidence-based practices, getting information out there, coordinating and collaborating, and providing training and education. So this is the framework that we use as the Autism Council. Okay. So when I think about, you know, what is the purpose of the ASD state plan, we want a comprehensive review of the progress that we had made since the original plan. So we kind of gathered all kinds of information to say what progress have we made. We wanted to be able to communicate those accomplishments, because you should always celebrate your accomplishments, not just like look at, you know, where the gaps are. Something we did with the original state plan is we did a survey of stakeholders. This time around, we did an even kind of bigger survey, and I'll share some of that data with you. And then we wanted to kind of establish our new priority recommendations, and then kind of provide that direction for where we're going to go as a state. So I really appreciate that we have this opportunity to share this with all of you, because you're going to help us with that kind of strategic direction and making these things happen. So like I said, one of the things that we did is we wanted to share the progress so far. I know this is very hard to see, so I'm going to open it up here as a PDF so you can see it a little bit better. One of the things we wanted to do is kind of create an infographic so that it's a little bit easier to see this progress. Hold on, I got to move some things around so I can make it a little more readable. Okay, one of the big things that changed, and for those of you who have maybe not done this for as long, I don't know if you've realized how big this is. I know some of you have been doing this a while, and you know, but the insurance reform made a huge difference in accessing services, both through private insurance and Medicaid. So prior to this, there were stories of families basically mortgaging their houses, liquidating their kids' college funds so that they could pay for services for their child with autism. For the most part, families don't have to do that as much, although the problem is the insurance does not cover everybody. If you're self-insured, those policies don't necessarily have to provide those services. So we do still have a lot of gaps in the system, but it's a lot better than it was. As I mentioned, we have the Autism Council in place. And then we have a lot of other things, and this is certainly not exhaustive. We just wanted to highlight. But we've been through various organizations doing lots of education for law enforcement and first responders. I don't know if you know, but we end up with, a lot of people with autism, when they encounter law enforcement or first responders, can end up in situations that are really, really difficult if people don't understand the autism. And so that education has been really important. We've got new money to early on services, our birth to 3 services. It's a very underfunded system, but we know early intervention is really important, and they just received some additional funding since this infographic, so we're really excited about that. We've got autism evaluation centers around the state. We've got a lot more kind of physical, mental, and behavioral health, a lot more behavior analysts working with kids. We have more project search sites who are providing internships and trainings for young adults. And then we've got a lot more educational services in place and trained professionals, including a lot of peer-to-peer supports, which is how we get that kind of integration in kids with kids. And that's a big project of ours within the START project. So lots of really, I think, cool things going on, lots of progress since that original plan. But we know that there are still gaps. So we wanted to put together some new recommendations. And in order for us to do that, we wanted to gather some information. So we did some stakeholder surveys. I'm going to show you that data. We got a lot of input through the Autism Council. And then our ASD state plan work group kind of pulled together all of this information. We looked at the progress, the needs, and the priorities, and wrote up this new document. So anything pop up in the chat or any questions up till this point?
Nothing new yet.
Okay. And Michael, feel free to jump in if you see anything that pops up in the chat.
Okay.
So let me share with you some of the stakeholder survey data that kind of came out of us, just sending this out. I think through all of the Autism Council members and all of our kind of constituent groups that we represent, we were able to get this out pretty broadly in the state. And today I'm only going to share with you a very small amount of the data. But I can tell you that when we looked at the representation, we've got representation from across the state, from lots of different groups. So we felt like it was a pretty good representative sample. So here's who the surveys went out to. They went out to ABA providers, families of children birth to 18, and then families of adults. It went out to medical professionals and clinical professionals. So that group ended up being a pretty broadly defined group. So it was everyone from physicians, nurses, speech language pathologists, OT, psychs, and so on. Public mental health providers through the public health system, and then school professionals. So we felt like we got a pretty good response. And so let me show you what that looks like. I just pulled out today one question that we thought was a key question that informed our recommendations. And that is, what are the most important priorities for the state to improve services and quality of life for all individuals with ASD? So when we sent this out, we asked them to identify 8 priorities from a list that we generated. They could also add their own, but we kind of wanted to be able to code it. So we gave them a long list, and then they could prioritize their top 8. So here's what we got. I don't think there's anything terribly surprising in here, but I think it's very validating. So these were behavior analysts, and we said, what was most important to you? And what do you think they said? Access to applied behavior analysis services was their #1 priority. And then it was autism insurance coverage, care for children with severe problem behaviors, and then education training for school professionals. Those were kind of their top priorities. So probably not too surprising that that's what we heard from the ABA providers. So for families of children aged birth to 18, Their number one priority was increased funding for school programs supporting children with autism. Second was autism insurance coverage, which we thought was interesting because at this point the insurance legislation had passed. So this tells us that there are still a lot of families who either are not getting insurance, have very large co-pays, or there's some kind of barrier for them to access insurance coverage. Number 3 was education training for school personnel. And then number 4 was access to community opportunities. And that kind of comes back to that integration, you know, really being a part of the community. Just for comparison, here the blue bars are actually our survey data from 2011. And then everything in red is our 2018 survey data. Because we wanted to do a little bit of a comparison to see what the differences are. In our new survey, we added this question, increase funding to school programs. So once that was added, that then became like the number one priority for families, which we thought was really interesting. And then number 2 and number 3 actually remained the same across the 2 different surveys, that education training for school personnel and insurance coverage. So we actually saw some consistency from a span of, you know, really 7 years. They're kind of telling us the same thing. That was kind of interesting.
Amy, we have one thing in the chat. Yeah. Jessica says, interesting how families really see needs in school settings. Yes.
And we kind of see that because this is where kids spend most of their time, right? You know, this is where they are, you know, 7 hours a day. So I think it kind of makes a lot of sense. You're going to see a theme here in a minute. So families of children over 18. So this includes kids 18 or young adults 18 to 26 who may still be receiving services within the education system. And so their number one priority is access to employment services. Again, not surprising for that group. Number 2 is access to quality housing. And number 3 is access to higher education. And number 4 is increased funding for community activities. That's the integration and, you know, being part of their community. So again, these are not terribly surprising, but there are places where we can see that there are gaps and there's more work we need to do. Survey of school professionals. Number 1, education and training for school personnel. Number 2, this is an important one because it's a theme, a care for children with severe problem behaviors, because we're seeing that a lot in the school system. Number 3, increased funding for school programs. And then interestingly, number 4 is access to employment services. Because I think because here in Michigan, we're pretty unique in that we have students in the school system potentially from 18 up to 26. We're trying to figure out how are we creating those for those young adults. If you don't know, we are the only state that goes up to age 26. Most states go up to age 21 and then they move over to their voc rehab or community health system. So we're a little bit different. So here's a comparison of the 2011 survey data to the 2018 survey data. So school professionals in 2011 said coordination and collaboration was number 1. Now that's number 5. We're trying to hypothesize, does that mean coordination and collaboration is better now so that they don't need that as much? We're not sure. But number 2 in 2011 and number 1 in 2018 were education training of school personnel. So we need to continue to do that. So we did see some shifts in some places. Number 3 here in 2011 was peer-to-peer support programs. Now moved down to number 6. We think that's because we now have over 800 peer-to-peer programs in the state. So we've actually done really well in boosting peer-to-peer programs. So we don't think that people see it as quite the same need because we have them. Just to kind of move along here, public mental health professionals, their number 1 issue is care for children with severe problem behaviors. Number 2, access to applied behavior analysis. And 3, access to health care. And 4, access to employment. So we're seeing some themes here. Medical professionals, number 1, access to clinical providers. Number 2, care for children with severe problem behaviors. Number 3, access to health care. Number 4, autism insurance coverage. Again, we're seeing some themes, not surprising. So here are kind of the priority themes that we saw. So the items rated in the top 5 by at least 3 stakeholder groups, access to employment, insurance coverage, severe problem behaviors, access to ABA, education training for school professionals, and increased funding for school programs. Were all kind of consistent themes that we saw across all of the folks. And then I kind of list some of the other themes that I think came out. Access to community opportunities was really important. One of the things I think we were a little bit surprised was we didn't see more coordination of care as a priority, since we talk about that a lot at the Autism Council, that we think there needs to be a lot more coordination, but it didn't come out in the survey as much as we thought. So this is the data that we then took and put that into the recommendations. So we took that, we had a number of Autism Council opportunities to give input from the constituents that they work with. And then our work group started pulling it all together. And here's what we came up with. The focus areas really mirrored our original plan. We just made some slight changes. But the primary focus areas were around family engagement and involvement. We wanted some recommendations around that. Early identification and early intervention, educational supports and services, adult services, and then physical, mental, and behavioral health. One of the things we wanted to really make sure we pointed out is that these are interrelated and complementary. So obviously young children have physical, mental, and behavioral health. So those are not mutually exclusive, but we had to have some way to kind of organize these things. So they certainly inform each other, but we kind of wanted to make sure that we were kind of hitting across all the different age areas, but then also big topics like family and physical, mental, and behavioral health. So those are the focus areas. And then within each one of those focus areas, so every single focus area, we looked at coordination and collaboration of systems, development and dissemination of information and resources, training and education, and service provision. Those were the themes that came up across all of those focus areas. So just to kind of give you a picture of what this looks like, so it's not so abstract. If you have a copy, you can pull it up. If you have it electronically, or if you have a electronic version, or handout, whatever you have. I'm going to jump past a lot of the kind of introductory pieces and just bring us to this very first focus area. So the first focus area is family engagement and involvement. And one of the things that we said when we created this is we said we are not making a 100-page document. We're going to keep this within 20 pages, and we're going to try to keep the recommendations to 1 page. For the most part, we were able to honor that goal because we wanted people to read it. So what you'll see is kind of the focus area goal. So this was the goal that we had, and then we jump right into recommendations. So these would be the recommendations around coordination and collaboration, and then around information, training and education, and service provision. So everything is on this 1 page. So if you're thinking what does the state plan say about family engagement, it's all there in 1 page. If we're looking at early identification, early intervention, again, all on 1 page. The education supports and services was the only one we couldn't get all on 1 page because there was a lot there. But that's how we set up the document. One change that we did make from the original is we pulled out the infrastructure recommendations, and these were really kind of the policy and practice recommendations, and these support all of the focus areas. We pulled that out and made that kind of a separate section. and that was a little bit different than the original. So these would be the things that you would hope that all of the state agencies, and I think even, you know, like Myland, I mean, you're having kind of a statewide kind of impact. You could look at some of those policy recommendations. But if you're more of a provider and you really want to focus more on just kind of like the practices around early identification, you could just go straight to that part of the document. And then finally, one of the other changes that we made from the original plan, and if you were to go to page 3 of the document, we decided that, you know, what we really wanted to do was make a call to action at the very beginning of the document. It's, I think, pretty common to write these kinds of plans. We looked at state plans from many, many other states, both when we wrote the original as well as when we wrote the update. Some of them are, you know, 150 pages long. Some are more concise. They're all a little bit different. And we said, you know what, we really want people to read this. And we wanted to be a call to action, not just something that goes to the governor's office and the Autism Council that nobody reads. So this was our call to say, you know, please read it and please know that this is about all of us. And so this is kind of an excerpt from our call to action. I don't normally read slides, but I am going to read this one. And we said it's really imperative that individuals from a broad range of stakeholder groups, including families, providers, educators, university faculty, business leaders, and legislators, read this document and immediately consider how to proactively respond to the recommendations to impact individuals with ASD across the lifespan. Specifically, this document is a call to action. You can identify focus area recommendations which are aligned to your agency, organization, or constituent group, and consider how the recommendations are relevant to your interactions with individuals with ASD and their families. So I hope that kind of resonates with you and kind of pulls you in, because it really isn't a document that's all about, you know, those policy folks. This is for each one of us, we hope, to look at and say, what can I do? So I know we're a little bit short on time. So Sharon and Michael, do I have just a little bit of time?
Yeah, how much more time do you need, Amy? Because I can try and adjust the schedule as we go along, but
I think I could do it in 5 if I have 5 more minutes.
Absolutely, go ahead.
Okay.
Yep, thanks for asking.
Because to me, this is kind of the real part of it. I did a whole bunch of talking, but what I would like for you to do, since I think everybody has a copy, is to take your copy. If we want to go back, if you look in the table of contents, you can see the focus area recommendations, and then we have the state infrastructure recommendations. Take a look at that and think, okay, where would I be able to have an impact? Like where am I engaged? Go to that page number. And I know we're not gonna have a whole lot of time, but I'd like to give you just kind of 3 minutes to just pick one that you think would resonate to you, and take 3 minutes and take a look at it. And I'm going to set my handy dandy timer so we stay on track. And then we'll come back and I'll ask you just kind of what you think. So if you've made it through the reading, we have one more minute. I would say just develop just like one idea or one thing that you think you could do that maybe could address a recommendation.
Again, please feel free to unmute and add your comment.
All right, that was our time. I know that was really fast, and there wasn't a lot of time to kind of reflect and process. So hopefully you'll have a little bit of time to think about it. But can we take just like maybe 2 minutes? And I'm just interested in hearing, you know, what people kind of took away that you might be able to do to impact the recommendations. Doesn't have to be big.
Kristen wrote in the chat, I work for Michigan Alliance for Families, and will continue to give out the Michigan Autism Council's document about educational evaluations for ASD. A lot of families are frustrated by the difference in medical and educational ASD evaluations.
Yep. And there are some documents with some guidance around that. So if you don't have that, you can get in touch with me and I can make that available, because there is a lot of confusion there. But there's a collaboration document that came out from the Michigan Association of Administrators of Special Education around how we work together around ABA services and evaluations. But thank you for disseminating that. You know, one of the biggest challenges is just getting this information out there.
Natalie writes, I love family training and education. As OTs, we do this all of the time for home programs. I've been working on assembling my own packet for addressing challenging behaviors through gross motor / proprioceptive, sorry Natalie, etc. activities. I am not an OT, obviously.
No, that's excellent, because you saw that there's that theme of significant. One of the biggest issues that we run into across everybody, whether you're in the public mental health system, ABA providers, families, schools, and it is one of the biggest barriers to access to community and integration. So we need to figure that out. And there are some great resources out there. All right, so I think I'm at my time limit. Letting me have just a little more time. If you have any questions, you can feel free to reach out to any of the council members. I'm available. You can send me an email if you have any follow-up questions. I'd be happy to answer those. But yes, thank you for letting me come in. I think one of the things that we know is if we have really good systems in place, such as in the recommendations, and when we do have crises, whether they're, you know, big ones like this or a family crisis, it means systems are working better to support individuals, and that's what we're shooting for. So thank you.
Thank you, Amy. That was so helpful. And you didn't ask for extra time. You just asked for some of the time that you lost because you didn't get to start right away. It was so informative, and we always appreciate you sharing with the team. So just a huge thanks. And team, feel free to reach out to Dr. Matthews with questions you have. I know it was a little, you know, time is more limited today. Anything from the group, any questions for Dr. Matthews before we shift topics? I'd like to give you a applause, and I don't know if there's a virtual applause, but this was great.
Thank you, and you've got the PowerPoint, so if you want to share that, feel free to do that too.
Yes, we were planning, and then we'll just make sure that all the resources that you shared, that we share with all the group.
Great, thank you.
Thank you.